Well, Chiquita, 20,000 job cuts in one agency, that's obviously a very big cut. You call them kind of cavalier. What do you mean by that, and what's the impact on public health and also federal health agencies?
You have to think about what HHS does for the American people. And you put a quote from the current secretary saying that these cuts will not affect Medicare and Medicaid, these essential services to millions of people. I think that the administration needs to prove that that is not true. At CMS, for example, 300 people have been let go during this last round. These people, many of them, are the ones who answer the phone when you have a problem with your Medicare benefit. For doctors and nurses, for hospitals, they're often the ones on the front lines who are answering those questions, resolving those problems, communicating to people. They are the people who ensure quality in our nursing homes. When you have kidney dialysis and need to be at an institute, need to be at a facility, the things that people do at HHS affect the lives of every American, and they are crucial to our economy. And you have to be very careful when you are looking at people's responsibilities to make sure you understand their roles. And every administration is going to make changes. That's the right to do so, but you need to do it carefully to make sure you're not going to harm the American people.
All right. So, Chiquita, you're being very reserved about this. I would imagine there's also some personal impacts. I'm sure a lot of people being impacted are people that you know. But I want to go back to what you're saying and kind of bottom line it. Are you saying that this push for more efficiency is reducing the effectiveness of some of these federal health agencies and the effectiveness of people on the outside that you're mentioning, hospitals and doctors, to access some of these resources?
Absolutely. I mean, this is just devastating. And to say the human impact, it's not just the people who are losing their jobs. They're losing it in such a heartless way. It's causing fear and intimidation. People are resigning and retiring. So there's just a push out of some of the most senior people in the administration who really make sure that, like I said, that
Okay.
people are safe.
Let's talk about public health very quickly. We've been covering it here on CNBC, the measles outbreak down in Texas. Is that potentially emblematic of other things that we could see? I mean, I personally, I thought measles were eradicated. I actually had to Google what they were. I didn't even know what they were. I've never seen anybody with measles. But is that a symbol of something that you see happening more and more often? Is that spread of diseases and maybe even some other things that were previously addressed with vaccines, maybe not being addressed with vaccines, other situations like that? What's the scenario that you see going forward?
I think that that is absolutely a very serious possibility of seeing diseases that we just haven't been thinking about, that have been, as you said, we assumed were eradicated. They're gone because people get vaccines. They're gone because people get treatment immediately. And if we don't have a secure public health program operating in our country, it's going to affect not only us, but also the rest of the world. And I want to turn to also just the research, what we've seen at NIH, just academic institutions across this country are under threat in terms of getting their grants pulled. And I think
Okay.
when you really think about innovation, we're really concerned about what this is going to mean to our scientific community, what we see in terms of drugs coming to market, and just the ripple effects. It will take us decades to recover from what we have seen